All right, I hope everyone can see my screen. Good afternoon. Thank you guys for joining us. My name is Sarah. I'm the Director of Outreach and Community Relations at NYSARC Trust Services. And NYSARC is a not-for-profit organization that has been administering supplemental needs trusts since 1972. And we primarily assist individuals with disabilities and seniors with disabling chronic conditions in helping to qualify and maintain their financial eligibility for means-tested benefits using pooled trusts. Thank you guys very much for joining us today. We do have a lot to cover, so I want to jump right in. But before we get started, I do just want to ask everyone to please just mute yourselves if you're not speaking, just so that we don't have any background noise. And we are going to try and cover our material in the first 30 to 40 minutes and allow about 20 minutes at the end for questions. So please do feel free to submit any questions that you have in the chat throughout the training, and we will get to those at the end. I've also asked one of my colleagues to drop the materials into the chat. It will be a link where you can download a copy of these PowerPoint slides and some additional materials with information about NYSARC's trust programs. So please check out the chat and get that downloaded, and feel free to follow up with me after if you do need additional copies. So NYSARC Trust Services has been presenting webinars throughout this year, and we have spoken about some of the changes that are coming to community-based Medicaid services. So we do want to start really quickly with some good news to update the attendees today about the look-back period for community-based long-term care services. And for those who are joining us for the first time, I'll give you just kind of a quick background. You may be very familiar with the 5-year look-back for nursing home care, which is when an individual needs Medicaid to cover the cost of nursing home care. When they apply, Medicaid will look back 5 years at their finances to see if you transferred any money out of your name during that period of time in order to become financially eligible for services. Now, up until this point, that has just been for nursing home level care. And community Medicaid in New York, where you're getting home care services or personal care services in your own home or the home of a loved one, also things like assisted living facilities or taking advantage of social or adult daycare services as well, you have been able to apply for those benefits without a look-back period. That means that if I'm in need of services, I can properly transfer money out of my name or spend that money down and then apply for Medicaid in the following month and be eligible for services. As long as I did do that properly, they're not going to look back at my finances. Now, as of last April, New York State has opted to implement a new look-back period for community Medicaid, which at the time was expected to go into effect this past fall. Then it's been delayed a number of times due to the ongoing public health emergency. And we are excited to share today that it has been delayed even further. At this time, today, April 1st, the last time we met, was the intended date for the new look back for community Medicaid to go into effect. And that has been further delayed. There have been some dates thrown around, but at this time we don't have anything official. So just know that it's delayed until further notice. And it is certainly, kind of tied to what's going on right now with this public health emergency. So as long as we continue to be in this public health emergency, at this time, New York State does not intend to begin implementing this. What this means for the people that we serve is that you have more time to plan. If you're someone who's considering needing home care in the next 2 to 3 years, you can begin looking at what assets you have and doing some planning so that you can start that clock, so that when you do need care in the future, that hopefully you'll be outside that look back window, any transfers that were made. It also extends this window of opportunity for those that need care now to be able to apply under the current rules, which are more flexible and, as I mentioned, allow you to transfer assets out of your name and qualify for benefits in the following month. So for those that are in need of services, as long as you do apply for those benefits prior to the look back being implemented, we are being told that this will not apply to you. Again, as long as that application gets in before they begin implementing this change. Once it is implemented, the Department of Social Services will review applications and look back to October 1st of 2020. So if it were to go into effect, let's say over this summer or at the beginning of next year, it will not be a full 2.5-year look back initially. They will just look back to that October 1st deadline. So for those of you who may have already done your planning and transferred your assets prior to October 1st, you'll be okay. For anyone who transferred assets after October 1st, it may benefit you to consider applying for those services prior to the look back going in place. And certainly we are always going to encourage individuals who have assets that they may need to protect to speak with a legal professional, someone who is tracking the updates related to these changes. There is new information coming out every day. So we do want to be sure that you are, speaking with a legal professional if you have questions or you want to, learn more about what options you have depending on your financial situation. We also want to be sure that people understand that there are exempt transfers that you can make that would not incur a penalty for Medicaid eligibility. And some of those things do include the use of trusts like special needs trusts or pooled trusts. If you are an individual who's under the age of 65 and you have assets that you need to spend down to become financially eligible for Medicaid, you're able to deposit that money into an S&T or a pooled trust without incurring a penalty, as long as you are under the age of 65. Also, for seniors who may be on the call that are looking to do some asset planning, know that if you have a child with a disability, you can transfer assets directly to that child or to a trust for that child's benefit, which is often the better option because giving money directly to a child with a disability could also impact their financial eligibility for means-tested benefits that they need, like Medicaid or supplemental security income benefits. And so these are some examples of exempt transfers. There are others as well. And so again, we encourage you to speak with a legal professional if you have questions about how to spend down assets appropriately in order to become eligible for services. We also want to make sure that everyone understands that this look back will apply only to community-based long-term care services. So for those who are applying for Medicaid benefits, for basic health benefits, and also individuals who are recipients of OPWDD, TBI, or NHTD waiver services, that the look back will not apply to those individuals, again, once it does go into effect. Now, transfers of assets apply both to income and resources. And so there are some questions related to, what this will look like in the future and how people will be able to use pooled trusts going forward. At this time, we are still awaiting any final rules and regulations. So we certainly don't want to speculate on that at this time, but we do want to make sure people are aware that you can continue to use pooled trusts. They are a great tool to use at this time to help seniors and people with disabilities be able to qualify financially for benefits. And we're going to focus today's training on talking about the ways that you can use a pooled trust and what are some ways that you can be sure that you are spending down that money on a regular basis so that you're maximizing the benefits you can receive and supporting your ability to stay in the community. So with that, I'm going to take a step back and begin with kind of a general overview of why someone is going to use a pooled trust and what is the process to become financially eligible when you're in need of community-based long-term care services. The reality is that for families, the cost of home care, nursing home level care, assisted living is very expensive. So many people in New York State seek the help of Medicaid benefits to help with the cost of these services. Oftentimes, people are either private paying for these benefits and quickly depleting any life savings that they have. Other times, family members may be providing unpaid care and trying to support their loved one in the ability to stay in the community, but maybe they need some extra assistance or someone to come in and help out their parent when they're not able to be with them. Now, in order to qualify financially for Medicaid benefits, they look at two categories of your assets. Resources, which is money that's in your name, and assets that can be easily converted into cash. So things like, bank accounts, savings accounts, stocks, bonds. We did get a question about life insurance coverage. That is going to be something that they look at as far as what is the cash value of that life insurance could be counted towards your resources. So you're going to look at all the assets that you have in your name. And if you have any more as a single individual than $15,900, you would need to get that money down below that limit in order to be eligible for services. Now, there are some exempt assets as well. Retirement accounts, for example, the principal balance is an exempt asset. And your primary residence, as long as it's below a certain value, which is rather high, I think over $900,000 at this time, your home would also be exempt at the time of applying. But it is important to point out that if you're receiving required minimum distributions from that IRA, that could count towards your income. So you're going to take a look at all of those assets. And if you need to spend down assets, there are ways that you can do that. Private paying for services is one example. Certainly, there are other strategies as well. And that would be where you'd want to consider consulting with a legal professional about what options might make the most sense for you. And at this time, as I mentioned, there is no look back as long as you're applying for community-based services. So as long as you're looking for home care or you're going to stay in the community, perhaps with a loved one or use an assisted living facility, you're able to transfer those assets and qualify for Medicaid in the following month. Going forward, once we do have that new community look back, there will be a 30-month look back for applications for community-based services once that does go into effect. Now, once someone spends down assets, or in some cases, the individuals you're working with or your family may not have assets, a lot of assets that need to be spent down. Perhaps you've already spent down assets by paying for services privately. But many people will find that they have an income issue, where even if you don't have a lot of money in assets, your monthly income from Social Security retirement, perhaps those required minimum distributions from an IRA, could even be Social Security disability income for some individuals who may be receiving that benefit, pensions, alimony payments, all of those sources of income that you have on a monthly basis are added up to calculate your total monthly income. And if your income exceeds around $904 a month for a single individual, you are required to spend that money down on a monthly basis in order to qualify financially for Medicaid benefits. So for those individuals whose income is too high to qualify for Medicaid, this is the amount that, so above that $904, and that is going to be your excess monthly income. So you're allowed to have $904, and as long as your income is below $904, you're financially eligible from an income standpoint. But if your income exceeds that amount, that is what's called your excess income or surplus income. Now, even though you have income that's too high to qualify, that doesn't necessarily mean you can't get services. For people with disabilities and adults who are over the age of 65 who are seeking long-term care services, they're able to spend down that income on a monthly basis in order to qualify for Medicaid benefits. And this is called a spend down, or sometimes referred to as a Medicaid income spend down. Now, if you have a Medicaid income spend down, you have a couple of ways that you can meet that spend down on a monthly basis. Certainly the easiest is taking that amount of money that's over the $904 and sending a check to Medicaid each month. That's like paying a premium towards your Medicaid benefits, and certainly would be the simplest way to meet the spend down on a monthly basis. The other option would be to use that money towards the cost of your medical expenses. You have medical bills throughout the month that you're paying, and you can submit receipts to Medicaid up to the amount of your spend down. And once you have paid enough medical expenses that month, they will pick up the cost of any other services that you have. Now, that is certainly one option. However, by giving the money to Medicaid or using it towards medical expenses, many seniors are left with very little money to live on. That's the thing that that you need your income for, things like your rent or utilities, things that are going to keep you in the community and allow you to get care at home. And so in New York State, we're very fortunate. We have the option to spend down our monthly income in what's called a pooled trust. By using a pooled trust, you're able to deposit your spend down each month into an account that can then be used for non-medical expenses and allow you to continue to cover your basic living needs and pay for things that are going to assist your ability to live safely and comfortably at home. Pooled trusts are allowable under federal and New York State statute, and an individual does need to have a qualifying disability in order to participate in a pooled trust. Now, this is the Social Security Administration's definition, which means you're not able to work for a period in excess of 12 months due to some disabling condition. And so for anyone on the call who may be thinking, oh, I don't have a disability, many seniors, the things that go along with getting older, chronic health conditions that you face, or just simply the need for assistance at home and assistance with activities of daily living is typically going to qualify you to participate in a program like this. You just may need to document that disability with your local Department of Social Services in order to use a pooled trust. And we'll talk about that when we talk about the process of getting things set up. All pooled trusts are run by not-for-profit organizations, where an organization like NYSARC manages your excess income on behalf of a person with a disability who's referred to as the trust beneficiary. This gives that individual the ability to qualify initially and on a monthly basis maintain their financial eligibility for Medicaid to cover care in the community. It allows seniors to be able to afford to continue to live at home, provides an alternative to nursing home placement, and allows them to try and stay at home for as long as possible. The trust is irrevocable, and that is to protect the person's eligibility for benefits. If you could set up this trust and at any time decide you no longer want to participate and just have the funds returned to you, those funds would be considered available to you and would not actually protect your eligibility for benefits. So the trust is irrevocable, but that doesn't mean that you can never get out of it. If at any point in the future you no longer need Medicaid benefits or you no longer want to use the pooled trust, you simply contact the trust, you opt out of it, and the trust will work with you to spend down any funds you may have in the account on eligible expenses during your lifetime. Now, Medicaid is kind enough to allow individuals in New York State to utilize their excess income using a pooled trust during their lifetime and use it to try and keep them in the community and support and provide for life-enhancing purchases. But upon the passing, according to federal statute, the trust account must close, and any funds that are left in the account after a person's date of death are typically retained by the pooled trust to support other people with disabilities that are served by their not-for-profit. If the pooled trust did not retain the funds, those funds would go to repay Medicaid in the states that provided services on your behalf. So this is a great tool that allows seniors to use their excess income throughout their lifetime. And upon their passing, those funds can then further benefit other people with disabilities who are served by the not-for-profit that administers the program that they choose to go with. So why might someone use a pooled trust? Obviously, with the options of giving the money to Medicaid or using it towards medical expenses, a pooled trust is typically a no-brainer for most people. Using a pooled trust to spend down your excess monthly income allows people with disabilities and seniors who are in need of home care services to be able to stay in the community and receive that care that they need that's paid for by Medicaid, while preserving that money to pay for their living expenses and make purchases that are going to improve their quality of life. Now, today's training, we're really focusing on applying for a Medicaid spend down and using a pooled trust for that purpose. But I do want to point out that pooled trust can be used to protect both income and assets for an individual who receives Medicaid or supplemental security income benefits and needs to spend down money in order to qualify or maintain those benefits. One of the questions that we received prior to today's training was if this is relevant for individuals who are residing in an OPWDD congregate level 2 home, and for those who may be residing in the community, either alone or with family. And we do want to be sure that people know that if you're working with someone who is receiving Medicaid already, and they come into a sum of money, they certainly can use a trust to deposit that money. Traditionally, when someone's in that type of a residential facility, they may be receiving Medicaid and SSI benefits, where it's traditionally not a Medicaid income spend down, but they may have resources on a regular basis that are accruing that may need to be spent down. Individuals receiving SSI are subject to a $2,000 resource limit, where they can never have more than $2,000 in their name. And so when someone's in that type of a situation where they are needing to spend down money, maybe not necessarily on a monthly basis, but could just be regular deposits that need to be made to keep them below that $2,000 threshold, this is absolutely an option for them. Under the age of 65, they can do that without worrying about any sort of transfer penalty. But if someone is over the age of 65, we do encourage you to contact us and we can talk to you about what benefits they receive and any considerations that they may need to think about as far as what their options are to spend down funds in those situations. Sometimes you can spend the money on the individual and that makes sense. Other times putting that money into a trust might benefit them better over the long term. We're seeing this more and more as the individuals that we serve during this past year have not been able to get out as much, and they may have unspent funds that are accruing, things from DAC benefits, and also extra money that's coming in from federal stimulus payments and extra unemployment benefits as well. So we encourage you to contact us if you have any questions about an individual who might be in that situation. So continuing on our discussion about the community-based long-term care services, we're going to give you a couple of examples here to just help guide us through the rest of today's training. So here, Hilda is 80 years old and she's single. She lives alone in an apartment and has a number of chronic health conditions. She's been private paying for a home health aide for a couple of years. And as you can see, her money in her savings account is getting quite low. So she's at a point where she really needs some assistance. She wants to be sure she can continue to keep her home health aide, but she's no longer able to afford to pay for that herself. She doesn't have resources that need to be protected, but she does have income of $3,000 a month from her retirement and a pension that she receives. So in order to be eligible for Medicaid benefits, she's going to have a spend down of almost $2,000 a month. That's going to be difficult for her to come up with medical expenses that aren't already covered by Medicaid. And that's a lot of money to give to Medicaid each month, leaving her only with $904 to live on. So using a pooled trust, she can deposit that money into the trust. The trust will take a small fee to administer the account on a monthly basis. And she can submit requests to the trust to pay for things like her rent, utility bills, and also make other purchases that might improve her quality of life, like getting haircuts, or perhaps going to visit her grandchildren. Maria is living in the community independently, and she receives Social Security disability income and Medicaid. Her monthly income from Social Security disability is just over the income limits, but she does need to spend down $300 a month in order to maintain her eligibility for coverage. She needs those Medicaid services. That's going to be the way that she can continue to live independently in the community, get her Medicaid medical benefits covered, dental coverage, get transportation to her doctor's appointments. But by spending down that money and giving that money to Medicaid each month, she has very little left to live on. And so depositing this spend down into a pool trust, she's able to keep her Medicaid benefits. And then she can submit bills to the trust to pay things like maybe her electric bill or her cable bill. $300, isn't a whole lot of money, but it's always a good idea to try and pick one or two larger bills that will reduce the amount of paperwork she needs to submit to the trust. So how does this process work? When someone's in need of Medicaid benefits and they're going to apply for the first time, they're going to start with step one by taking a look at the resources and seeing if they need to do any planning or spend down any of those resources in order to become financially eligible for benefits. Then the individual can apply for Medicaid, and if that individual does not already receive SSI or SSDI benefits, they may need to fill out some paperwork with their local Department of Social Services to deem them formally disabled in order to utilize a pooled trust. Now, applying for Medicaid can take a couple of months, whereas applying for the pooled trust can be done very quickly. We can typically open an account in about a week's time. So many individuals will choose to start the Medicaid application process and then apply for the pooled trust once they have a determination from Medicaid of what their income spend down will be. Others like to apply for the pooled trust and submit that documentation with their application for Medicaid. It's really up to the individual and the family to determine what makes the most sense financially in your situation. But those are the options. Once you do apply for the pooled trust, the trust will send the documents back to you, countersigned, and the individual is responsible for providing that documentation to Medicaid to be sure that they are aware that you're using a pooled trust to meet your spend down each month. Once you begin making your deposits into the trust, NYSARC can send a verification of your deposits to any agencies upon your request. Medicaid will come out and do an assessment to determine how much care is needed and what they will provide. And once you have funds available in your account, you can begin submitting requests to the trust to pay for your monthly expenses. Now, it's important to point out that the order of these steps really do vary depending on where you are in this process. If you are someone that's already receiving Medicaid benefits and has a spend down or comes into a windfall of money that you need to spend down, you can begin at step 4 by simply applying for the pooled trust. Whereas others that are, looking to apply for the first time are going to want to start in the beginning. There is a nice video here I'm not going to play now, but I do encourage you guys to watch this. It's a great kind of success story and overview of how one individual here in Rensselaer County utilized our trust program to get home care services and what services she was able to obtain through Medicaid and how the trust was able to support her monthly expenses. Enrolling in a pooled trust is also a very quick and easy process because the documents have already been drafted. Unlike an individual trust where you need an attorney to draft a trust document, our documents have already been created and approved by the Social Security Administration and Medicaid. And so joining the trust is simply completing a copy of the joinder agreement, which is the application to join the trust. And this document does need to be signed and notarized by the trust beneficiary. If the trust beneficiary does not have is not able to sign the document on their own, it does need to be signed by someone with the legal authority to establish and fund the trust, like a power of attorney or someone's legal guardian. If you have a situation where someone is not able to sign the document, please feel free to reach out to us and we can talk to you about what documentation requirements we may need and who is an eligible signer in that person's situation. Once the application is completed, you can attach a copy of the beneficiary's Social Security card and Social Security award letter and include a check for a minimum of $300 made payable to NYSARC and community trusts for the benefit of the beneficiary's name. You could mail that complete package to NYSARC Trust Services at our address in Latham, and we will review the application, and approve. Once the account is approved, as I mentioned, we will return the documents to you, whoever you noted on the application, who's going to be responsible for submitting those documents to the appropriate agencies, which is typically going to be your local Department of Social Services or the Human Resource Administration, HRA, if you're in the New York City region. It may also be your managed long-term care plan if you're participating in an MLTC. So once you are enrolled in the trust, you're able to begin making your spend down deposits. Spend down deposits do need to come from the beneficiary's own income, and they need to be made on a monthly basis. Medicaid is a month-to-month program. Each month, you need to deposit the amount of your income, that is the excess, into the trust. And you can do that by setting up electronic deposits, where the trust will pull the funds from your bank account on a set day that you choose. You can also mail a check with a deposit slip each month. Once funds are available in your account, you can submit requests to the trust by fax, mail, or email for the bills and expenses that you'd like the trust to pay. We do process disbursements every single day to ensure that we are paying things as quickly and efficiently as we can. And we are now able to process a number of payments for participating vendors electronically, where once we receive your request, we can electronically make that payment to the vendor so that that payment is made even faster. There are also a number of ways that you can, a number of options for you to set up automatic payments for expenses that are fixed and recurring on a monthly basis, like a rent payment, where you don't need to submit the documentation every month asking us to pay your rent. You can set that up on auto pay, and each month we'll pay that on the date that you choose. We also have a couple of other options, things like mortgage, property and condo maintenance fees are things that can be set up automatically. And recently we expanded into car loans and lease payments, and the ability to pay irrevocable pre-need funeral arrangements. This is where you go to a funeral home, you set up your burial arrangements. It's typically quite a large expense, and the trust can work with you to determine a set amount you'd like to pay towards that each month, and we can also pay that automatically. We encourage you to contact us if you have any other fixed recurring expenses to inquire if those are eligible for automatic payment. So each month, in summary, your spend down or excess income goes into the trust. The trust will take their monthly fee, and what's left, you'll submit bills to the trust to pay for a one-time expense or recurring monthly expenses, and the pooled trust will remit payment to a third party. Now, there are rules about how the money in the trust can be used, and the first and most important is that the money in the trust is intended to be used for the primary benefit of the individual, the trust beneficiary. And that means bills need to be in the beneficiary's name, or you need to provide documentation that shows that whatever expense you're asking for the trust to pay is for the primary benefit of that beneficiary. This is a supplemental needs trust, which means that it's intended to supplement the benefits that someone's receiving. So we can never pay for items or services that are provided through Medicaid or other means-tested benefits. Typically, that comes up for someone receiving SSI, that we cannot pay for food and shelter without causing a reduction in their SSI benefits. It could also come up for someone who's receiving Medicaid benefits in a residential facility. There are certain things that residential facility is required to provide. And so the trust is going to be able to pay for additional things once any basic needs have already been met that the facility is required to provide to the individual. All disbursement requests that you submit to the trust do need to have some form of documentation that shows us what we're paying for or what was paid for that we may be reimbursing. This is going to be things like receipts, bills, or invoices, and we'll get into a little bit more detail in the next slide. And each disbursement is paid to a third party. This could be a third party like a business, your landlord, your utility company. It could also be a third party like your adult daughter who is going out and buying groceries for you. We can reimburse your daughter for that purchase. It is important to note that we cannot give cash directly or reimburse you, the beneficiary, or your spouse. That would put the money back into your household and make it available to you, which could impact your eligibility for services. So if you as the beneficiary or your spouse want to go out and make a purchase, we'll talk about on the next slide ways that you can do that. But you can also have someone other than someone within your household buy that for you, and we could reimburse that individual. The trustee, there are so many things that the trust can be used for. We're going to talk about a couple of examples of the most common things, but the list is endless. It is important for you to know that the trustee of the trust, in our case, NYSARC Trust Services, does have the sole discretion on the use of trust funds, and that is to protect your eligibility for benefits and ensure that the funds are being used for your benefit, and that we are not paying for things that could potentially impact your eligibility for services. So that is for your protection. And certainly our trustees are always making those decisions based on what's in the best interest of our beneficiaries. Now, the process to submit a request to the trust is quite simple. You fill out a request form. You're going to detail it, provide information about who you are, what your account number is, who you're asking us to pay, what amount. That form does need to be signed by the beneficiary, or the beneficiary does have the option of naming certain individuals in their life who they would like to be able to submit requests on their behalf. And those individuals also have the authority to sign the form. You can then attach a copy of an invoice or a bill that needs to be paid, or it could be a receipt for something that you purchase that someone's looking to get reimbursed for. You may need to attach additional documentation if it's a more complicated expense, like, for example, if someone's asking us to pay for property-related expenses and the house is in a trust, there may be some additional documentation that's needed. So we encourage you to contact NYSARC if you have any questions. And we do provide quite a bit of information in our information and procedures detailing some of the most common requests and what the documentation requirements are for those. You also want to be sure that there are adequate funds available in your trust account. The trust can only pay up to what is available in your account. And as long as you do have funds available, you can send that signed form with the supporting documentation to our office by fax, email, or mail. Some of the most common types of disbursement requests are going to be, bills, expenses. Again, the goal of the trust is to help keep seniors and people with disabilities in the community and allow them to be able to afford to live at home. And so our preference is going to be to pay your basic living needs and be sure that all of your monthly expenses are met before considering making purchases that might be more life enhancing. So traditionally, these are things like your rent or mortgage, where you're going to provide a copy of a bill, utility bill, could be insurance premium, things like newspaper and magazine subscriptions, Life Alert, Netflix. Again, the list is quite long. Then there are also situations where you're wanting to go out and buy things like clothing or groceries, perhaps over-the-counter items that you may need. And in order to do that, the individual is either going to need to have someone make those purchases on their behalf and seek reimbursement, or the individual can make those purchases on a credit card and submit the itemized receipts with a copy of their credit card bill, and NYSARC can pay their credit card. What you can't do is go buy groceries with your checking account and ask NYSARC to reimburse you. That would put that money into your bank account. That would make it available to you and could impact your eligibility for Medicaid services. So using a credit card allows you to have that flexibility to go out and make purchases. And it can also be used if you want to continue to have that control over your monthly finances. Maybe you have your utility bill set up on auto pay every month. You can keep that on auto pay on your credit card, and every month just submit the credit card bill with a copy of the electric bill or the cable bill, and NYSARC will pay your credit card. Now, when it comes to using the trust for things like groceries and clothing, as you're hearing, there's a couple more steps involved, and obviously there's additional paperwork. So what I usually do is encourage people to pick one or two larger bills that add up to about what you're going to have available in your trust account each month, to use those bills to be the things that you submit to the trust, and use the money that you get to keep every month, that $904 that you're allowed to keep in your account each month, for things like grocery purchases, going out to eat, doing things out in the community, which are expenses that you would have to keep track of, itemized receipts. But certainly we understand that in some circumstances, like Hilda in our example earlier, she's got a $2,000 a month that she needs to spend. Once we pay her rent, her utility bills, she does still have money left over. So groceries, clothing items, those are all great ways to use the funds in the trust. You can also use the trust for larger expenses. Maybe someone needs repairs to the home that they live in, something that might make the home more accessible to them. Perhaps it's just regular upkeep. Maybe a larger expense like furniture or computers, iPads, for example, for all those seniors who may be isolated right now and looking to stay in touch with family. These are all examples of things that could be purchased through the trust, as long as it's for the individual's primary benefit. And some of those expenses might be quite large. So it's always a good idea to contact the trust before making a purchase like that and just talk to them about it. Make sure that it is something that the trust could be used for. And you can always obtain a quote or an invoice for that service and submit it to the trust ahead of time so that we can pre-approve that expense. Now, here's a list of what are some of the most commonly used ways that people use the trust. And I'm going to talk about these in a little bit more detail and pretty quickly here so we can get to questions. Now, we've gone through a number of these items already, so I'm going to kind of skip through the list. But rent is, I would say, one of the most common things people use the trust funds for. And that's because it's something that can be set up automatically. So if your e-deposit is coming in and you're automatically paying your rent, it really does help automate this process for the individuals we serve and make it as easy as possible. I do want to point out that if an individual is living with a family member, it is an option for the trust to pay that family member for the cost of the living expenses of their loved one that's living with them. Now, we can't do that for a spouse. We wouldn't be able to create a rental agreement for someone to live in a home with their own spouse. But if someone's living with an adult child, that is absolutely a way to use the money in the trust. Certainly a mortgage. And as we look at perhaps having, higher spend downs in the future that need to be spent down, that is something that the trust can pay as far as paying off portions of the mortgage to be sure that people are using the funds on a regular basis. Property taxes is another great example. If someone has funds building up in the trust as a way to use that money for a larger expense. Things like utility bills, obviously transportation, we can now do car loans and lease payments automatically. So again, those are ways to help kind of streamline this process and make things easier for the people that we serve. And going forward, I think this is something we're seeing more and more of, which is individuals who are using the trust to supplement the care that they're receiving through Medicaid. Perhaps someone's only authorized for 8 hours a day, but the family feels that they need additional time. The trust can pay for additional hours of home care that's not being covered by Medicaid. And in order for the trust to do that, we do need to pay an agency for that. So you submit an invoice for the hours worked and the rate of pay, and the trust can pay the agency for that aide's work in the home. Oftentimes, however, individuals want to use someone where they may be employing them more directly. So we do have ways that you can go about doing that by utilizing household payroll services. to be sure that you are properly paying that individual, and so that the trust is not acting as an employer. We would not ever be able to directly pay a home health aide for their services. And if you have questions about that, I think that's something that more people are going to be utilizing as we look to the future of potentially higher spend downs and the need to spend funds on a regular basis. And so we encourage you to call us to talk about that in more detail and talk about what options are available. An irrevocable pre-need is always a great idea if you don't already have something set up to utilize the money in the trust if you are finding that you have a balance or funds left over that you'd like to start paying towards that expense. Again, that's something that can be paid automatically. In addition to, again, basic needs being met, we can also cover life-enhancing things that are going to improve someone's quality of life, like getting their hair done might be something that someone enjoys. Going out to dinner with family, that might be something someone enjoys. And so as long as someone has their basic needs met and funds are available in their account, those are other examples of ways the trust funds can be used. When it comes to managing the account and monitoring it, we have lots of ways that the family will be able to keep tabs on what their balance is in the trust and the activity on a day-to-day basis. We have a live customer service team that's available during our normal business hours on weekdays. We can provide multilingual customer support for individuals who may need that. And we offer a number of tools to allow people to monitor their account after hours, like an automated phone system and an easy-to-use online portal, which really has been great, allowing people to manage their account, but also verify deposits and access important documents and forms that they need to utilize their trust account. We also send statements, and we can report to government agencies as needed with things like full detailed activity histories and verifications of deposits. The trust does also handle all tax reporting for the trust, and that is included as a one-time tax and audit fee, which is charged every year in July. And I did put here on the screen also just a summary of the costs to set up and maintain a trust on a monthly basis. This is for the Medicaid income spend down program, but I did provide a detailed copy of our fee schedule in the materials. So we do encourage you guys to take a look at that. These fees are going to be based on the amount that someone's depositing each month. But these fees cover all trust activity. We have no limit on the number of requests someone can submit on a monthly basis. And we don't charge any sort of annual renewal fees. But that is something to keep in mind. There are programs out there that do have those types of limitations. So that's something you want to keep look into and see what each program you're considering, because those annual renewal fees can cost hundreds of dollars a year. So with that, I want to open things up for questions and just remind everyone that we are hosting our next webinar on May 20th at noon, same time, lunchtime, and we'll be talking about pooled trusts more broadly, not just income spend downs, but when you can use a pooled trust for lots of different individuals, many different situations, protecting income and assets. And so we encourage you guys to join us. We will drop the registration link into the chat as well. And it is here on the slides that you received. So if you're interested, we hope you can join us. So with that, I'm gonna just toggle over to the chat quickly and see what questions we have from our attendees. So obviously first was about the slide deck, and yes, that is available. So this is a link where you can download the materials from today's training. That link will expire after 30 days. So just please be sure that you do get in there within the next week or so and download any materials. We also provided our contact information. If you have any questions, my direct contact information is also here on the screen. And we encourage you guys to follow us on LinkedIn, Facebook for updates as we get new information in the future. Once we do get more guidance from the Department of Health regarding these impending changes with the community look back, we will be hosting future trainings to make sure that everyone is aware of these changes and how they will impact the individuals that we serve. So there's a question here about the statutory gift rider, whether or not that is still needed for the power of attorney in order to transfer assets to a pool trust. I would advise you to speak with a legal professional about that, but my understanding is that that rule did recently change and that is no longer needed. However, that would definitely be something to ask a legal professional and have them review your power of attorney to be sure that you do have what you need. It is something that when someone is signing the joinder agreement as a power of attorney, we also ask for a copy of that and our team can review it as well. We got a question about how to handle situations where someone receives SSI benefits and your payment to a third party may impact their SSI eligibility. So my question here would be if you're asking if the payment from the trust to a third party may impact their SSI eligibility. Again, it would not be going to them directly. It would go to someone other than the person who's receiving the SSI benefits. So it should not impact their eligibility. However, that is something, that may be determined on a case-by-case basis, depending on the individual's benefits and who we're providing that money to and what their relationship is. So I definitely encourage you to reach out to us and maybe provide a little bit more information for us to kind of properly respond to that. There was a question as far as if individuals are automatically, SSI recipients automatically qualified for Medicaid. That is certainly the case. Most individuals who receive supplemental security income benefits, their income and assets are well below the financial limits to qualify for Medicaid benefits. And so those are not situations where someone would have an income spend down. However, someone who has SSI may be receiving funds regularly that are accruing that could impact their eligibility for SSI from a resource standpoint. Things like extra unemployment benefits. Many people are receiving federal stimulus payments, perhaps DAC benefits, which is not a Medicaid spend down, but that is money that you're receiving on a monthly basis that can quickly accrue above $2,000 as if that person's not using it every month. And so that's the concern for people with SSI, is more for their SSI resource limit. A person on SSI would not have a Medicaid income spend down traditionally. One question was if the transfer to a spouse is an exempt transfer for community-based services. So this is a question that you definitely want to speak with a legal professional about, but traditionally an individual is able to transfer funds to a spouse, and there are lots of things that go along with that. So definitely want to speak with a legal professional before doing that on your own, just to be sure that you are doing things properly. One question was to clarify the part about SSI and a rent payment. So if someone is receiving supplemental security income benefits, those benefits are intended to provide for food and shelter. And so if a person also has a trust where they're asking for the trust to pay for, let's say, their rent, if the trust paid that expense, it could potentially reduce that person's SSI in that month that we paid that expense, because it's considered in-kind support and maintenance, where we are replacing a benefit that SSI is supposed to provide. Now, typically, a person is not going to use the trust for rent to avoid causing any sort of reduction in their benefits. However, depending on how much money someone has in a trust account, that reduction is typically a 1/3 reduction in their benefits. And so there are some circumstances where someone might decide that it is in their financial best interest to use the trust for rent so that they can get into a better apartment. And that's something that really is very unique to an individual situation as far as how much they're receiving in an SSI payment on a monthly basis. and what impact that's going to have on them financially if the trust pays for their rent. So if you have a situation where someone's receiving SSI and they want to use their trust funds for rent, we encourage you to contact us and we'd be happy to work through that with you in the context of that person's situation. And again, that really is for any sort of housing expense for SSI, or again, any sort of food related expense. Those are things that if the trust paid for those, they could cause a reduction in someone's benefits. There's a question about, would a trust work with someone under the age of 21 whose parent still gets child support? That is something I definitely would encourage you guys to contact us to speak more about. That's going to come down to kind of who that income goes to directly, and whether or not that parent is still kind of financially responsible for that child. We certainly do have, I know I can think of one example with an individual who is over the age of 21, that they do receive some money from not only child support, but DAC benefits. And again, receiving that money each month is not necessarily an income spend down, but it does push them up against the resource limits typically. And so if someone is needing, if that money is in the name of the beneficiary and that's considered part of their resources, then that individual could deposit those funds into a pooled trust in order to maintain their eligibility for benefits. There was also a question about the use of a pooled trust for a person with a disability, if the pooled trust could pay funds to an ABLE account for that person's needs. Now that's pretty complicated and we really didn't get into ABLE accounts too much. So I don't want to, I'll cover it kind of high level. There certainly are circumstances where if someone's able to utilize an SNT and an ABLE account, that there may be something that someone wants to purchase that an ABLE account could pay for that an SNT may not be able to, like housing expenses would be one example. And so a pooled trust may transfer funds to an ABLE account for perhaps that purpose. However, there's a lot of things to consider in that situation that the trustee is going to really review that on a case-by-case basis, because we need to be sure that the funds are in fact used for that expense. So there's many things that would go into that, but it is certainly possible for an individual to be able to utilize both an ABLE account and an SNT, and there can be some benefits to someone if they are doing that. I definitely would encourage you guys to reach out to me directly if you want to learn more about ABLE accounts and what are some of the benefits to using SNTs and ABLE accounts as a complement to each other. And then finally, we just have one other question, it looks like, for now. And please, I do encourage you guys to submit any other questions that you have. And if you have questions that come up after today's training, please feel free to reach out to us. Is whether a transfer to a pooled trust for resources is considered a transfer of assets out of a guardianship estate. Think about that for a second. I guess I'm not sure what you're referring to as out of a guardianship estate. Whether or not a transfer to a pooled trust is considered a transfer with relation to whether it's going to cause a penalty period or not is typically determined based on the benefits someone's receiving and how old they are. So whether or not it's a penalty coming out of a guardianship estate, that's something that I can certainly look into, get some more information, and I will follow up with you about that to provide some more information. We did get a request to resend the documents for the materials. So Nina, if you wouldn't mind just dropping that link back into the chat for anybody that has not had a chance yet to download a copy of the PowerPoint slides, we'll go ahead and provide that. Okay, so Claudia, I do see what you're asking now as far as funding a trust. So if a guardian does not have the authority, so if a guardian has is the guardian of the person, but they don't have the authority to move their assets, then yes, that can be a situation where that guardian is not actually able to establish a trust for someone because they don't have the proper authority to fund the trust. And unfortunately, that does happen quite often where we have a situation, we know someone needs a trust, but they don't necessarily have someone who has the authority to fund it on their behalf, and they are not and do not have the legal capacity to do it on their own. And so unfortunately, in those situations, we do often need to go to the court to have the court essentially give the permission to fund the trust. The guardian certainly can sign the document for them, but they do need to have the power to transfer those assets on behalf of the individual. And that does come up sometimes. So again, we encourage you guys, if you're in a situation like that, to reach out to us. We deal with these types of things all the time. We see this a lot. So we're happy to, provide more detail, explain what documentation is required, and talk to you about your unique situation to figure out how we might be able to assist you. And then there's a final question. I think this is really important that we do touch on, is that what expenses can a pool trust pay after someone has passed away? And the answer to that is none. Once a trust account is established, that trust account can be utilized during someone's lifetime. And upon the date of their death, that trust account closes and no payments can be made out of the trust after their death. So we want to be sure that we're submitting requests regularly to the trust and contacting the trust if the individual goes into the hospital or is not doing well, to ensure that you're able to use as much of the money as possible during their lifetime. NYSARC will honor requests that were submitted prior to someone's date of death and that just didn't get processed in time. As long as we did receive the request prior to that date of death, we are able to process that. But it is a federal law that the trust account closes and no more funds can be paid out of the trust at that point. So if you have things after the person has passed, we would not be able to pay those from the trust balance. And that's really important. So make sure that you are staying in contact with the trust to ensure you can use as much of that money as possible during that person's lifetime. There's someone who mentioned that they were told that someone can have up to a month at the end. Again, many programs administer their programs differently, and they may perhaps use other funds to pay for those expenses, but the funds cannot come from someone's trust account. It is our policy that the trust account closes upon the passing of the individual. And again, we can only pay for things that were received prior to that date of death. And that's just to be sure, again, that we are following the federal regulations. Technically, that money is now owed to Medicaid. And so according to the POMS that oversees the administration of these accounts, we are not supposed to be paying that money to any third parties before repaying Medicaid first. So typically those funds are fully retained by the trust to support other people with disabilities. And again, if you guys have questions about that, please feel free to reach out to me. I'm happy to speak to you in more detail. We did provide an extra copy of those slides here, so please take a moment to download those at this time. And again, email me if you have any trouble. We're happy to send those over to you directly. We thank you guys for joining us today. We appreciate all the questions, and we hope that you can join us on May 20th for our next webinar. Please do reach out to us in the meantime if you have any questions, and we hope you have a wonderful day.